Welcome to our pharmacology revision class 63 to 26. That is the first series. So this is my first series and the first episode. I'm requesting that you subscribe to the channel so that you get as many questions and answers as possible. So we go to the first question. Using specific examples, distinguish between receptor and non-receptor mechanism of drug action. You first of all need to ask yourself, what is this receptor? What is a receptor? Then what do we mean by mechanism? Because we want to distinguish between a receptor and a non-receptor mechanism of drug action. So number one, what is a receptor? Number two, you need to know what is meant by a receptor mechanism and what is meant by a non-receptor mechanism. Another question that you need to ask yourself is, what are the effects of a drug interaction with a receptor? So what names are given to a drug that interacts with a receptor and produces an effect? What name is given to a drug that interacts with a receptor but does not produce a physiological effect? So those are the things that you are supposed to involve in this question. So let's proceed. Let's begin with looking at the word receptor. Receptor refers to that substance, those proteins that are normally found on the cell surface or within the cell. So a drug normally interacts with a cell through a receptor interaction. So there are drugs that normally directly interact with receptors, and there are those drugs that do not interact with receptors. So mechanisms through which drugs interact directly with receptors are known as drug-receptor mechanism of drug action. Then if a drug acts without directly interacting with the receptor, it's known as a non-receptor mechanism of drug action. So examples of receptors are cholinereceptors, insulin receptors, and also adrenergic receptors. Aluminium hydroxide and magnesium trisilicate, which are normally used for treatment of peptic ulcer diseases, act by non-receptor mechanism. These drugs normally aid in neutralizing gastric acid. The ability of a drug to bind to a receptor is known as drug affinity. Then the ability of a drug to bind to a receptor and produce physiological effect is known as drug efficacy. Basing on that, some drugs have got affinity but lack efficacy. Then there are some drugs that have got both affinity and efficacy. Forces that attract drugs to a receptor are known as bonds. So examples of bonds are hydrogen bonds, covalent bonds, van der Waals forces of attraction, and also ionic bonds. Covalent bond is the strongest. A drug-receptor complex is irreversible. On the diagram, I have illustrated an equation of a drug interacting with a receptor. So D stands for drug, R stands for receptor. Then a drug-receptor complex may dissociate to form a drug and a receptor. So this constant will be referred to as a constant of dissociation. Then, if a drug-receptor complex brings about biological effect, that process is known as intrinsic activity. We go to question number 2. Describe drugs under the following subtitles. Number 1 is site of action. Under site of action, you need to know that drugs may act extracellularly, intracellularly, or on the cell surface. So number 1 is site of action. So drugs that act extracellularly include osmotic diuretics and plasma expanders. Then drugs that act on the cell surface include penicillins and catecholamines. Number 2 is dose-response relationship. Now, the exact relationship between a drug administered and the response depends on the type of an organism under observation and also the type of a drug that is administered. Now, when the graph of response against the logarithm of the dosage administered is plotted, a sigmoid curve is obtained. Now, a sigmoid curve refers to that curve that is S-shaped. That S-shaped curve is what we call a sigmoid curve. You also need to know minimum dosage and maximum dosage. Minimum dosage refers to the lowest concentration of a drug that elicits response. Maximum dosage, on the other hand, refers to the maximum concentration of a drug beyond which increase in concentration will not change response. Next, let's look at graded dose effect. As the dose administered to a single subject or tissue increases, the pharmacological effect increases up to a ceiling effect. The concentration that is required to produce 50% of the maximum effect is referred to as ED50 or EC50. Next is quantal dose effect. From the word quantal, we know that it is quantity. Sensitive organisms or tissues respond to smaller doses of a drug, while some will be resistant and may require larger doses. So on this diagram, I have illustrated a quantal dose effect curve. We have said that it is a curve that shows the relationship between the response of an organism and the logarithm of the dose administered. I have drawn it here. So that is a sigmoid curve. So let us look at the features of the quantal dose effect curve. So feature number 1 is median lethal dose. This refers to the dose in milligrams per kilogram that is expected to kill half the population of the same strain or species. Next is median effective dose, also referred to as ED50. This refers to the dose in milligrams per kilogram which is expected to produce a desired response in 50% of the test population. So you also need to know something about therapeutic index. So what is a therapeutic index? Therapeutic index refers to the approximate assessment of the safety of a drug. It is the median lethal dose divided by median effective dose. So I have given out a formula that is therapeutic index is equal to LD50 over ED50. 50 means 50% or median. So we go through our notes. Using specific examples, distinguish between receptor and non-receptor mechanism of drug action. Receptors refers to protein molecules found on the cell surface or within the cell. Most drugs act by interacting with receptors, while others act through simple physical or chemical means without interacting with the receptors, e.g. cholineceptors, insulin receptors, and adrenergic receptors. However, endogenous neurotransmitters, corticoids, hormones, and most of the drugs produce their effect by binding with specific receptors. Aluminium hydroxide and magnesium trisilicate, which are used for treatment of peptic ulcer disease, act through non-receptor mechanism by neutralizing gastric acid. Drug affinity is the ability of a drug to bind to a receptor. Drug efficacy is the ability of a drug to bind to a receptor and produce a physiological effect. An antagonist drug has both affinity and efficacy. Antagonist drug has affinity but lacks efficacy. An agonist drug has the ability to stimulate a receptor and mimics endogenous transmitter. Antagonist drug, on the other hand, blocks a receptor. Forces that attract drugs to a receptor are known as bonds. So the bonds include hydrogen bonds, ionic bonds, covalent bonds, van der Waals forces of attraction. Covalent bond is the strongest and drug-receptor complex is irreversible. So I have explained this equation. Describe drugs under the following subtitles. Number 1 is site of action. Drugs may act, number 1, extracellularly, e.g. plasma expanders and osmotic diuretics. Then on the cell surface, that is the penicillin and catecholamines. Then inside the cell, that is anti-cancer drugs and steroid hormones. Number B is dose-response relationship. The exact relationship between the dose administered and the response depends on the organism under observation and the type of drug used. It gives a sigmoid curve when a graph of response against the log of administered drug is drawn. Minimum dose. This is the lowest concentration of a drug that elicits response. Maximum dose, on the other hand, is the maximum concentration of a drug beyond which increase in concentration will not change response. Then graded dose effect. As the dose administered to a single subject or tissue increases, the pharmacological effect increases up to a ceiling effect. The concentration that is required to produce 50% of the maximum effect is termed as ED50 or EC50. Quantum dose effect. Sensitive organisms or tissues give response to smaller doses of drugs, while some will be resistant and may require very large doses. Next is a quantum dose effect curve that I have drawn here. So let's look at its features. Median lethal dose, or LD50. This is a dose in milligrams per kilogram expected to kill half the population of the same strain or species. Median effective dose. That is a dose in milligrams per kilogram which produces a desired response in 50% of test population. Therapeutic index refers to the approximate assessment of a safety of a drug. It is the median lethal dose divided by median effective dose. So Ti is equal to LD50 over ED50. So Ti, that is therapeutic index, is equal to LD50 divided by ED50.